Thank you.
Okay. Well, a very warm welcome to everyone who's joining us in this 9th webinar of Secure. Yes, we are now in the 9th installment of the series that has started in February 2022. And since then, we've covered various issues from women's challenges, climate change, private sector engagement, and health communications. What these webinars have had in common is a commitment to lessons learned across the region. It's been all about knowledge sharing and community building. What's new is that we have a forthcoming book that we're putting together from these lessons through these webinars and with our rich community of experts from the region. We will be launching this book next year, and we're excited to share this with you as well. Meanwhile, the knowledge sharing continues. And this time around, we're interested to discuss broader lessons about health governance and advancing health equity in the region. And also, thinking as a regional community, we also want to ask, what are the opportunities and barriers in regional collaboration in terms of health security interventions and health crisis management? We are honored to have two speakers to share their experiences and insights about this question today. Meanwhile, I am pleased to invite Dr. Eduardo Banson, Principal Health Specialist in the Southeast Asia Regional Department of the Asian Development Bank, to give us some welcome remarks.
Thanks, Gideon. And I think we would like to welcome everyone. You know, one of the things that it's like, I don't know, the pandemic seems to be history now, right? It's like, and when you think about it, it was about 2 years ago that we've, I remember, January 2020, right? Dr. Hinjoy, I was actually in the PMAC, if you're in Bangkok. And I remember that when we started to start hearing this talk about COVID, you know, there was a different name then. But we started to hear it about end of 2019, but we started to fear it by January. And I remember because when I was taking the cab from Sentara, I'm a lazy person. I don't want to walk. Although I was nearby. I started becoming afraid because everybody was trying to wear masks. I'm somebody who don't like wearing face masks. And I remember when we went back to PMAC, we started having all these checks, temperature check and all that. And you started to sense the panic. When I got back to Manila, then of course we started to see eventually how this, what was the coronavirus from, became in a sense what everybody has always been afraid of, the next pandemic, the next really big pandemic. And we saw how the world has changed. But what's also, of course, in really and the flu and the virus really spread so fast because we were in a different world compared, for example, in the 1970, 1919 flu pandemic. And at the time, they always said that it was when the soldiers coming back from Europe from World War I ascended was the one that spread it. You didn't need that many troops in a ship to spread the virus. Essentially, because the world was connected, people was traveling everywhere. The virus basically just flew everywhere. And soon before you know it, you know, the whole world was closing down. I think now, of course, we have recovered from the pandemic. The economies have recovered from the pandemic. But there are really lots of lessons that we have from the pandemic. It's not just vaccination. Of course, we saw how vaccination really made a difference. But it's also now, but it's not the story is more than just vaccination per se, but a question of, is this something that countries, middle-income countries, low-income countries should put money in? Because we saw how the vaccination story, basically, the vaccine supplies did not come to the developing countries as fast as they should be. We saw how it stopped movement of people, and then we realized how difficult it was for countries because the world now depends on migrant people working from one country to the other. Migrant workers has become a core part of the particularly Southeast Asian economies, and the Philippines, of course, particularly was affected. Also, other countries, I think Lao DPR, you know, when workers started to, so there are lessons also. And what's great, of course, is that there are also great lessons on how countries collaborated and cooperated in making sure that migrant workers or migrants were taken care of. The fact that we're actually having this talk in this Zoom, in this webinar. It was another lessons that was basically accelerated by the pandemic. We were forced to talk virtually. Technology evolved so fast. Telemedicine policies were basically, how do we call that? Barriers to innovations like telemedicine were actually overcome because all of a sudden, the system needed that to happen for people to get treated, for people to talk, for people to communicate, and all that. So I think there's a lot of lessons, and as we move forward, we should not forget these lessons. I've always seen documents that say building on the lessons of the pandemic, but we seldom get document about it. It seems like we just because it's no longer there, we think it's all in the past, and we just move on in life. So we look forward for the sharing of Dr. Kiri as he talks about the lessons from Lao DPR, from Dr. Hinchoy as she will talk about lessons from Thailand, and when Gideon later, and he talk about the other lessons that we have identified. Admittedly, December is really not a good time to have a webinar because everybody seems to be on holidays. But nonetheless, we will be sharing this webinar online. And we look forward for our discussions to make sure that we do not forget our recent past and that we continue to mine and generate lessons from what has happened from this pandemic and the interventions that countries did to address this pandemic, particularly those of Southeast Asian countries. So looking forward to the discussion, looking forward to the presentations of Dr. Kiri, Dr. Enjoy, Dr. Lasco. And hopefully, we'll have it will be again another insightful day for all of us. So Gideon, you have the floor.
Thank you, Dr. Banson. I share your anticipation of the lessons that we will be able to learn from this event. And now I would like to introduce our first speaker, His Excellency Dr. Lo Visnokiri, the Secretary of State of Cambodia's Ministry of Health for Health Planning, Health Policy and Planning, Social Health Protection, and Digital Health. Dr. Kiri began his career as an assistant surgeon in a national hospital. He has worked in Cambodia's public health sector for over 30 years. He has extensively engaged in reforming the health sector, both organizationally and financially, and he was at the forefront of Cambodia's pandemic response. He will be talking to us today about governing health crises beyond the COVID-19 pandemic. So let's all welcome Dr. Kiri. Thank you very much for joining us today.
Thank you very much for the introductory words. And good morning, very good morning, everyone. And first of all, I would like to express my sincere appreciations to the ADB, in particular the organizing team for these webinars in order to provide the country, including Cambodia, to share the experience and the lesson learned from the COVID-19 pandemics. Let me go straight to the content of my presentations. I had a very short slides. Like many other countries in the world, Cambodia has been affected by the COVID-19 pandemic, socially and economically, in addition to the life loss and the people affected. Nonetheless, Cambodia, according to our experience and practices, we will respond to the COVID-19. And currently, Cambodia is striking back for the social economic recovery and economic growth, and also for strengthening the resilient health system against future pandemics and the health emergencies. The key factors for the success of the COVID-19 pandemic is the strong leadership of the Samdech Mahasena Bandai signed the former Prime Minister of the Kingdom of Cambodia. With the collective effort of the Cambodian people, the whole society engagement, as well as the other partners, including the ADB, which provide timely and effectively logistic, and also material support to the Cambodian effort fighting against COVID-19 pandemics. Cambodia have adopted this balanced approach to quickly and swiftly and effectively implemented the public health measures. During the pandemic, Cambodia have introduced the laws on the fighting the communal disease, including the other disease pandemics. In addition, to the legal the laws, Cambodia have the plan very early for the COVID-19 vaccinations. We secure the high COVID-19 primary vaccination coverage. Primary vaccinations coverage over 70% of the total population in September 2021. It means that the 8 months ahead of the WHO target, 70% of the population covered by the COVID vaccinations in mid 2022 ago. This created the favorable condition for the reopening the country and the socio-economic activity in November 2021. Alongside the implementation of the public health measures, the government of Cambodia also has introduced the social support programs launched in June 2020. And this program has mitigated the negative impact of the COVID-19 on the social and economy, particularly the GDP, income loss, and employment. The limited health and social economic impact of the pandemics for the nations has demonstrated significant contributions to the global and regional securities. While Cambodia also maintain other significant health gains. For example, according to the latest Cambodian demographic health survey 21 and 22 indicate the further reduction of the marginal and the early childhood mortalities. Next one. Besides the strong leadership of the royal government of Cambodia, the other key factors were attributed to the success of the implementations or the effort of fighting against COVID-19, included established the well-functioning, broader-based institutional structure and mechanisms at the national and the subnational levels. Second, the substantial increasement in preparedness and response capacity of the health systems, and also mitigating the impacts on the social economies. So the active engagement of individual, family, and community with the meaningful participation of the health volunteer, private sector, civil society organizations. And last but not least, the timely technical and financial and logistic support from the other country through bilateral and multilateral cooperations. Despite the COVID-19 is no longer a global emergency, as declared by the WHO in March 2023, but the risk remains of the new variant emerging that can cause a new surge in case and death. In this regard, the further strengthening the operational readiness for timely, effective, and efficient response to emerging or the emerging infectious disease, including COVID-19, remain essential. Why we need to keep being vigilant during the year to come. Let me move to the looking forward. The resilient health system learn and adapt. The COVID-19 pandemic highlights that when the health is a risk, everything is a risk. Investment in health is not a cost, but an investment in the social and economic stability and also the growth and resilience. A key opportunity now exists to build on the lesson learned from the COVID-19, making the right investment now for a future safe and healthy Cambodia. As directed by evidence and Cambodian national need and priority, the Royal Government of the Royal Government priority directions are to further strengthen resilient health system toward universal health coverage, that is to prepare the health system for effectively address growing public health threat and emergency, maintain access to essential quality health services to the services is important, and also the ensure that the access to the essential services and the critical care without financial hardships, and maintain the health gain and ensure the health securities. In this regard, the Royal Government Body on the 7th legislature of the National Assembly has set one of the 6 priority policy program is to expand health services toward universal health coverage, with focus on the improvement of the quality of the health services through 3 key interventions. The first one is to strengthen capacity of health service delivery, in particular the primary health care at the health center is the first point of contact between the health system and the population, and also the strengthening the capacity of the referral hospitals. Second is strengthening the institutional capacity at the national and sub-national levels in terms of the resource management, including human resources, finance, other key health infrastructures, resources, and also the strengthening the regulatory capacity of the health system, and also the health security capacities. And third is building the strong partnership between the public and the private sectors in order to improve the health of the populations through delivering the safe, quality, and effective health services. The way forward in terms of the strengthening health system, we need to shifting the health system toward more sustainable long-term response to COVID-19 and beyond, with empowering the individual and community to make the right choice and save life and sustain livelihoods. In concluding remarks, I wish to highlight several aspects as input for these meetings. First, the COVID-19 pandemic has brought both challenges and opportunity to the health system, health, and the economies. This proves that the pandemic crisis can only be solved through the collective actionable insight nationally, regionally, even globally, with a strong international and regional collaboration and coordinations, solidarity and multilateralism, and also renew the collective commitment and the value of the national, regional, and international cooperation to tackle the pandemic's borderless challenges beyond the national actions. Second, there is a critical need for transforming the current national health security architecture and governance to fit for the future in protecting health of the populations through strengthening health system resilience and rebuilding the economy, trade, and development, with the high global regional political support in managing the current COVID-19 crisis and also the future pandemic. Third, maintain the global and the regional communications in a more effective and on the timely manners, and also sharing the global, regional, and country experience, good practices, workable policy, and also the innovative solution and technology that are necessitated to the successful control pandemic and the public health threat and emergencies, as well as to reduce its public health, economic, and social consequences. Last but not least, making the health cooperation more effective platform to boost the global and regional efforts, unity, and solidarity, where thereby all stakeholders are brought in together to collectively eliminate the current and the future public health crisis and its socio-economic consequences beyond the aftermath of the COVID-19 pandemic. I thank you for your attention.
Thank you very much, Dr. Kiri, for presenting this overview of all your experiences, and at the same time coming up with concluding remarks to make us think about what we can do moving forward. So thank you again for the presentation. And now we will have the opportunity later to engage our speakers in an open forum and to discuss some of the points they raise, including the very important point that Dr. Kiri raised early in his slides about health being an investment and not a cost, and the centrality of partnerships across all of these responses: public, private, national, regional, global, and so on. So now let me call our second speaker, Dr. Swapak Hinjoy, who's the Director of the Office of International Cooperation of the Department of Disease Control of the Thailand's Ministry of Public Health. A doctor of veterinary medicine by training, among many other academic credentials. Dr. Hinjoy is also a veterinary officer, but she has played a significant leadership role in Thailand's involvement as the chair of the Global Health Security Agenda Steering Group, engaging different stakeholders about global preparedness and responses beyond COVID-19. So it's my pleasure to now call on Dr. Hinjoy to give us our second presentation.
Thank you very much, and I hope that you can hear me well. Today, it is my great opportunity to provide our experiences on the COVID-19 and how we can raise the issue about the equity and the response in the best way for the of the population. So in my topic, we said about in the lesson from the past, challenge for the future. Okay, next slide, please. Okay, this is so when we say that we have a lot of public health measure for in the COVID-19 response. And before we think about in the vaccine, and that time even that you just provide back to in the past that in the before COVID-19 vaccine will be launched for everyone. And that time we have to use in the we call public health and social measures. And we know that in the population, at least for the COVID-19 in Thailand, it is not only for the Thai people, but all the people that live in our country. And also for in the vulnerable population that we call migrant workers. Why? Migrant worker is a vulnerable population because we have to accept that when we say that migrant population, we have both often the documented migrant worker and undocumented migrant workers. As we know, for the documented migrant worker, that means before they work, they bought in the health insurance, and that means they can cover even though they got sick from COVID-19, they can get to the right time. But for the undocumented migrant workers, they didn't buy health insurance because they fear of because they come to Thailand with maybe in illegal channel. So that means they didn't have a health insurance. But when we provide a COVID-19 vaccine for everyone, they can receive that too. Because in the documented and undocumented migrant worker, they can receive a COVID-19 vaccine from government of Thailand. But they fear to present they themselves to when they go to a vaccination station because they worry that maybe in the officials, government officer can send them back to a security and they can have a problem and send back to the country. So that's why vulnerable population that we focus. This is undocumented migrant workers. And for what we did during the for that time, we use the hotline we call migrant hotline. We started after talk among a stakeholder on in the 2020 on April that we asked for among stakeholder, and we said that why we didn't like provide like something that even the migrant worker would like to know about in the knowledge or the status of the disease. They can call without any like a barrier. That's why we work for in the migrant hotline and provide in the different language. And that time we have Cambodian, Vietnamese, or Myanmar, Burmese, and Lao. So we provide us, we train the people, we train the volunteer, migrant health volunteer, to help us to receive the call and provide the right answer and provide like some education program that in the migrant worker can understand what they should do dealing in the COVID-19. Okay, this is a hotline that during before COVID-19 vaccine camp. Next, please. Okay, and this is to see that actually in the migrant hotline, this is not in the first time when we launched during the COVID-19. Actually, we have this kind of in the existing system for the hotline, but at that time just provide for the Thai language. So COVID-19 we extend to the neighboring language that I already like provided. And for the Department of Disease Control, what we provide to support on this hotline, we provide the knowledge, we train the health volunteer to understand like the national history or the modes of transmission of COVID-19. We provide the updated situation, updated knowledge on the COVID-19. And also we work within the like a development partner, for example, like NGO and WHO provide the device that in the migrant health volunteer can use it. And we provide
Dr. Hinjoy, I think you've been
okay, sorry.
yes.
Okay,
Great. Thank
okay,
you.
that
Thank you.
okay, okay, and then in the we provide like a staff and also like a the like application just for like a advisor and also within the migrant health volunteer. Even though they may receive the call that is difficult question and they couldn't answer, that means they can consult on the live application. Okay, next please. So once we have COVID-19 vaccine came delivered to Thailand, we provide in the at that time we still have like a imbalance between the supply and demand. Even though you can imagine how like it's very like awareness and panic. Even there maybe some people they worry, okay, and now we still have like a written amount of COVID-19 vaccine. They may not receive that. So that's why we divide into like three groups in the like a prioritized group. For the first one, this is for the group that we call high risk group. That means elderly people, patients with their underlying disease, and also for the healthcare worker. That is we call in the front line. And also in this group, we call in the village health volunteer and migrant health volunteer. This is a part of the frontline workers in Thailand as well. And also for the people that work in the factory, like a labor or the migrant worker. This is a one of the prioritized group that we said that is the priority for receiving of the COVID-19 vaccine. Next, please. Okay, that this is the picture that show you that I think this is when we deliver of the COVID-19 vaccine for the migrant workers. I think maybe around in the August, something like that, between the June and August. That is like the same law within the village health volunteer or the that work together. So that means we prioritize the migrant health volunteer. This is a important key person to communicate, to educate the people for in the migrant community. So this picture we provide the vaccine for the migrant health volunteer, and this is quite like a lot of in the migrant health volunteer that they come and they receive the vaccine. And they after they receive that, they still like promote and provide how important the benefit of COVID-19 vaccine to the migrant community as well. Next, please. So it does not only ask for the migrant health volunteer to be like the presenter, how important often the COVID-19 vaccine to increase the vaccine coverage. We have provide like some like a communication channel. We talk in the different language. That in the we translate that and we provide and we share this in the video channel to all often the migrant community through the cooperation within the NGO that work a lot within the in the migrant community. And also we have like the comic. We can see that the comic that's been for like the students in the migrant community can easily understand about the COVID-19 too. And this is a comic, a story that we translated in the English, in Thai, and also in the neighboring languages. So that means we using the various kind of in the communication channel to provide education to in the migrant community. Next, please. And this is like a vaccine data for COVID-19 that we provide to foreigners that include the migrant worker too. You can see on in the left hand side, this is like the top tier of in the country that receive vaccine. You can see that Myanmar, Cambodia, and Laos. This is a top 3 country that in the receive COVID-19 vaccine, and we believe that all of in the top 3 countries, this is can be in the work in the part of in the migrant workers in Thailand. So and now right now we provide over is more than the 6 million doses of COVID-19 vaccine to foreigners and the migrant workers that in the live in Thailand. Next, please. Okay, so we know that in the when we try to increase the vaccine coverage of the COVID-19 among the migrant communities, and we can see that we still have like some gap that's hard to fill. So we use in the tool that we call Rapid Community Assessment (RCA2) to like implement that in the some community in the some provinces that have in the high density of in the migrant population, and we just have like an interview and talk to them, and then asking the question that in the tool, and we identify what in the barrier why they didn't want to receive in the COVID-19 vaccine. And the first thing that we reveal, the fear of in the adverse events, and also they still wonder about the effectiveness of vaccine, and they feel that they have like some language barrier and they couldn't understand well what in the government would like to communicate with them. And also they said that okay, vaccination site is still like far from their community, because in there some community they live in the very rural area or the remote area, and they didn't want to go to like a hospital to receive the vaccine. And so we have the problem that they work a lot, they move a lot. It's because sometimes they live in this province, but even though they work in the construction site, that means they have maybe in the next month they have to move to another province. So that's mean we can see that it is hard to like get them to in the complete doses of vaccine. And so for the undocumented migrant worker, it is quite it's a huge issue that because that they didn't have identification number to identify that person, because they came to Thailand with like an illegal issue. So that means when they when they went to like a vaccination site, they would like to provide that means the vaccination site asked them to provide like an identification card, but they didn't have it. But the hospital or the health facility need to like provide the vaccine. That means they generate like a temporary identification number of that migrant worker. But when they move for the second dose, if they move to another hospital to receive the vaccine for the second dose, It means that the second hospital, they have to generate the new one, obtain the identification number again, and the first temporary number and the second temporary number in the different hospital, they didn't link each other. So that means the data that we receive from our database, we couldn't see like the completed dose of vaccine. That is quite important. That we cannot see the real number, the valid number of the vaccine COVID-19 coverage, vaccine coverage. Next slide, please. Okay, next please. Okay, and that's why we we talk within the Thailand course and also within the Ministry of Education and for Ministry of Science to develop in the eyelid scan and also within the facial recognition to to use that among the migrant workers. So it means that when in the migrant workers they come to the hospital and then we use that eyelids and the facial recognition to scan to tell about their identity, and then the information will go to the crowd. That means if then that migrant worker come again to the hospital and they're using the eyelid scan or the facial recognition, the system can identify that person. So even that they move to another hospital, recording the data go to in the crowd to the server. That means another hospital can see what this is can identify that person too. So this is important that even though we can identify the person, so that means the hospital or the healthcare facility can provide the appropriate treatment and can provide the completed dose of vaccine to the migrant communities. Okay, and I think in the next slide, it should be the last presentation. Okay, that is all the thing that we are doing right now in Thailand and work within the multi-sectoral unit because we believe that no one is safe until everyone is safe. Okay, that is all my slide presentation. Thank you very much.
Thank you so much, Dr. Hinjoy, for your presentation using migrant health as a case study for health equity. And actually, it's very linked to what Dr. Kiri said as well in terms of how it's so important to have partnerships in different levels, both from the global level, which you both work with a lot, but also partnering with vulnerable populations, vulnerable communities, which resonates with all the countries that are represented in our discussion. So let me go right away to my own small reflections from these two presentations that we've just heard. I believe that, as Dr. Kiri said, health is not a cost but an investment. And he also highlighted how COVID has created a unique opportunity to ensure pandemic preparedness. Some systems have been put into place. Both speakers spoke about how there now exists some infrastructure that allows us to respond to COVID. Many lessons are still fresh, and more people realize the need for investments. But at the same time, there's less political capital to make these happen. There's less attention. There's less public attention. There's less media attention to COVID-19. So the challenge that both presentations imply would be commitment from different levels of government and how we can institutionalize some of these things, both at the national level and even at the regional level. So we do have now platforms at the regional level and the global level to facilitate health security agenda, lessons learned, and even vaccine development and vaccine sharing. So the challenge is how to institutionalize these relationships. And this resonates very well with what we've been hearing from the past webinars as well regarding public-private partnerships. For example, our forthcoming book talks about how a comprehensive legal regime is necessary because it removes the complexities that are needed for public-private partnerships. So having laws in place would make things easier if and when we face another crisis. So partnerships, as both speakers have shared, are key in different levels. And as Dr. Hinjoy mentioned, it involves literally learning their language. And this is very relevant for the multi-ethnic countries in our region. Aside from migrant workers, I think of indigenous communities, very relevant in the region. I think of rural and urban poor communities. Dr. Hinjoy also mentioned fear of adversary actions. And as we know from social sciences studies on the pandemic, these levels of trust are dependent on past experiences and also collective experiences with the public healthcare system, which is why a constant relationship, a constant engagement is necessary, and we cannot allow whatever trust that has been gained to be lost. So community empowerment was also mentioned, and we know as well that in the same way that in Thailand, it involved training the migrant health volunteers, responding to the pandemic and beyond involves really bringing in the community in all aspects of the pandemic, including communication. In our book, that's also, again, forthcoming. We know that our communications specialists have spoken about how a single report on national TV can make or break a vaccination campaign, and how, conversely, civil society, community-based and religious organizations with well-established relationships with entire communities can easily be tapped to get people to get vaccinated. So that's such a big role in communications as well. Another theme that emerged from the two speakers that we heard and also from the past webinars is how technology can play an important role in facilitating many of these necessary steps. Dr. Hinjoy's call for digital solutions ties neatly with some of the lessons we've heard, including the development of apps that combine technology, not just from the front end or apps that are intended for the public, but also digital solutions that make things more efficient, from vaccine distribution, from record keeping, and even human resource management, and so on. Technology has been implicated heavily as a key driver of innovation, and of course, will also require a lot of the things we talk about: partnerships, investment, commitment, and so on. The last thing that I would like to mention is the need for evaluation. We have heard many practices over the past 2 years. We've heard different programs that were piloted, programs that were scaled up, but the efficacy of these practices will surely benefit from further reflection and more rigorous evaluation as we move forward. Some countries have undertaken, and I think this is a very welcome step, many countries have undertaken evaluations of what went wrong and what went right with their pandemic responses. And I think that's what our book also contributes to doing. We're here not just to, of course, identify what went wrong, but also what went right, and what can we do to improve on that for the coming challenges in our shared health security, our shared health governance, and of course, the very important principle of health equity, to make sure that, as Dr. Hinjoy ended her presentation, that no one gets left behind in this response. So thank you again to our speakers, Dr. Skiri and Hinjoy. We now open the floor for discussion. Does anyone have any points to raise, any reflections, any comments or questions? We are now welcoming them. Perhaps we can start with one that's been shared to me, which is about, it's addressed to Dr. Kiri. So, Dr. Kiri, has there been an increase in the domestic budget for health security after COVID? And then, so the same person was asking, what is the Ministry of Health priority in terms of funds allocation that will strengthen national health security?
Thank you for the questions. For the of course the government has the invest the resources to strengthen the health security system or the capacity over the last 30 years. I think through even the ADB also provide the support through the regional project, namely the health security project for the Great Bear, for the GMS. And so, and during the pandemic, the government also has increased investment, the resources to strengthen the capacity of the health system. As you may know that the government have the invest the big establishment of the big hospitals with the capacity of the 10,000 beds recently opening for providing the services in order to prepare for any further outbreak of the pandemic in the future. If we look at the level of investment for the health security, the government continue to increase the budget for the health sectors. Prior the COVID-19 and also during the COVID-19, in particular during the year 2020 and 21, the overall budget for the health sector has increased almost double. In particular, go to the health security system, but also to the other intervention, which also contribute to build the health security system as well as to support the social program as well. Even now the COVID-19 has is no longer the public health emergency internationally, but also we understand that the future outbreaks of the infectious disease remain will continue. So that's why the investment for the health security remain on the priority agenda of the government. Like I mentioned that one of the key intervention for the first priority policy priority program is the expand the health services towards universal coverage. So the key intervention number 2 is to strengthen capacity of the national institutional capacity at the national and sub-national levels, not only for the resource management but also for health security capacities.
Thank you, Dr. Kiri. I think that more than responded to the question that's been raised. We have another question from Dr. Kanchit, addressed to Dr. Hinjoy, Dr. Swapak. So the question is, how can Thailand utilize the lessons learned from COVID-19 to continue routine services? I think this is referring to routine health services.
Okay, thank you very much, Dr. Kanchit, for your question. That in there we can see that in the what we learn, and we can adapt that and prevent that the same problem occur again in the future. Okay, for the first thing that we learn, actually for during the COVID-19, we have went to like a 3 or 4 assessment tool. For example, intra-action review. Okay, and so we have in that time we have in the IHR joint external evaluation assessment tool, and so we have like a after action review among the stakeholders, and we can see that the important we can set the prioritize for example the first one. We know that in the source capacity, like the people in the epidemiology training program, in the laboratory personnel. This is important, and we can see that we need them to be like maintain their like skill and not to be like exhausted from a lot of overwhelming work during the crisis. So that's why we work within the different organization that have like an expert for epidemiologies and also with the laboratory. For example, within the academy, sometimes we work within the private hospital or in the private partnership program to be the part of the certain capacity. And so this is the first one. And the second one, we know that in the data, big data, this is important because when we would like to predict or forecast or any situation and can prevent and set the measure to prevent that situation, try to reduce the the bad consequence from that in the situation. We need like a huge database. That means we need to integrate database forming the epidemiological database, laboratory database, and also we need to understand like a logistics supply and understand about the population, the vaccine coverage. So that's why after that we established like the committee in foreign data or information management that include the people. It is not only the health sector, but we are for like academic institution, and also we include the people from in the like a private sector. For example, like the bank company, because in the bank company is very like a smart in the term of in their connection and use database for customer service. So that's meaning that we can see that database by corporate within the relevant stakeholder. It is not government, it is not the health sector, but the private partnership. This is important. So that is what we learned, and now in the video a lot of things after during the post-pandemic. Thank you.
Thank you, Dr. Enjoy. Do we have other questions from our audience? There's another question that's addressed to Dr. Kiri about the legislative framework or the regulation in Cambodia in terms of pharmacovigilance and also in terms of the vaccination. So have there been any legislative measures that have been undertaken to codify or to collect all of the policies during the pandemic and make it more permanent or institutionalized in Cambodia?
We got to the vaccinations. We have the what I call the administrative order of the government. For example, how the vaccine, COVID vaccine, COVID vaccinations should be provided to the people. So rather the law or the any high level legislative tool, the government also issue the amnesty order, because amnesty order is also considered as the legal instruments. So we have the during the COVID pandemic, in particular with regard to the vaccination. So the number of the government amnesty order has been issued in order to reinforce the vaccination campaign, as well as the to promote the vaccination practices. For example, our approach for the vaccinations is we choose what is so-called that the flourishing flower approach in combination with the targeting approach. I mean that this approach is focused on the vaccination campaign or the vaccination program focus mainly in the urban area where the population where the crowded population living, and then we move from the urban area to the the other area because we through our the assessment on the regular basis to follow up the situation of the COVID transmission. We understand that in order to protect or to reduce this transmission, in particularly during the community transmission. So we need to make sure that the people living in a city or in a crowded area must be vaccinated first. And then in terms of the targeting, we also I think go very along the line. The WHO recommendation, for example, according to the vaccination eligible for any particular age group. So Cambodia, we start with the age. We start with the people from age 18 over, and then we move down from age 15. Age 15 to age 15 to under 15 to under 18, and then when vaccine is available, we move from 5 to 12 as well. And the other approach we use the two approach also the reinforced through the government the amnesty order. We use the fixed site and the mobile sites. So the fixed site we provide the vaccination at the health facility. Mobile site we send the mobile team around the country, which include the mobile team from the health volunteer to provide the vaccination. So we have prepared a well-prepared plan for the vaccination rollout.
Thank you, Dr. Kiri, for answering that question. So now I would like to relay this question from Ki Dar, or from Dr. Ki to Dr. Hinjoy again on how information on COVID vaccine adverse events has been shared across various. So I guess this is a pharmacovigilance question as well on how information sharing has happened across hospitals and whether there has been a platform available for adverse events.
Okay, thank you, Keita, for your questions. And I would like to divide in the two channels. For the first one, we have in the National Surveillance Program for the expert event immunization, AEFI, right? That is this already established, I think in the over 20 years. But for the COVID-19 vaccine, we have like a kind of recover, like a refresh the system and have like a special platform. That's mean all like an existing network. For example, like a government hospital or in the private hospital or in the academic hospital, they already understand about this AEFI program. But for the COVID-19, we provide them more strengthening on this program. That means they know that how, when to report and who that they can report to. And then we have like the civilian officer to monitor the situation. Even the situation is met within our case definition of in the AEFI from COVID-19, we have like the committee that in the national committee to consider like the and verify the case. And the national committee, this is a composed of in the different people from in the health sector, from in the professor in the academic institution, so from laboratory, from the advisor, and then they will like consider the case that in the report and make our definition. After that, after in the day, that means they have a lot of that's mean once a week that they have a lot of meeting and talk about the cases. And then after in the day verify, they will ask like a policy maker to make a press release about the case to make in their public like to understand what in the going on in the case. But you can imagine that this is like an official way. But when we have like fake news, right? When we have like a lot of in the TikTok, a lot of fakes, book that share a lot of messages, that means we have another section that monitor the news on the media. And then if in there any like a fake news, we have like the team that we call in the watch team to provide to collect the message and accuracy maker to provide the valid message to the people. And so we make like a channel recording on the TikTok on the YouTube and ask for the professor that really like the people touch on in the people from in the researcher from in the university, and we ask them to give the message on in the COVID-19 vaccine, what the case, what is the going on, and what is happen to collect their misinformation. Okay, that is one thing that in there how we communicate about in the adverse events of the vaccine to the people, and also within there to in the hospital too. Thank you.
That is that something that Dr. Hinjoy, can I follow up to ask on that? Is that something that was developed during the pandemic? This kind of monitoring of fake news, monitoring of all of these things. Is that something that was new and was driven by the pandemic, or has it been around even before the pandemic?
You mean like the system?
Yeah.
Uh, Before the pandemic, we also have this in the AFI surveillance system, but it's
Okay.
not like a more. It's actually it's a kind of like the routine
Okay.
surveillance system. It's like a passive surveillance system. But for the COVID-19, it's quite more activated like the system after during the COVID-19.
Okay. Thank you. That's something that might be another interesting point of comparison and sharing to different health ministries in terms of how to respond to, in a way, it's analogous to pharmacovigilance, but it's vigilance in terms of what people are talking about. So that's something to consider and think about in the future for regional sharing as well. Thank you.
Yeah, and I would like to add that the one thing that is important because in the government also set like the budget, even the people have like a report in their hospital report the case, and after in the committee identify that okay uh this is a adverse events from COVID-19 vaccine. We have like the budget to support to kill that people. Okay, so that's mean in there. That's good that in there. Our government set this kind of in there. Like a supporting financial budget that in there to kill the people in the term of in their mental health and also for in the any treatment that may occur, may be born from in their adverse event from COVID-19 vaccine too. This is important that in the how we can balance the feeling of the people and also get them to in the motivate them to receive the vaccine before in the we provide the appropriate treatment for them.
Thank you. Thank you so much, Dr. Enjoy. So now there's a question from Mr. Dakanay that we might want to raise to both speakers, to both Dr. Kiri and Dr. Hinjoy. And maybe you can use this opportunity to also share some final remarks in terms of what you want to share to the whole group about equity, given how, as we've seen all over the world, how the pandemic has demonstrated inequity across countries, across populations. So the question is, do you have recommendations on how we can use health cooperation among countries to address this issue of health equity in case another global health crisis occurs? So we can start with either of the speakers. Maybe since you're already there highlighted, maybe Dr. Hinjoy, and then we'll call Dr. Kiri after.
Okay, thank you. The project that in the we would like to continue for the future, it should be it's depend on in the situation analysis, what in the prioritized issue. So that's great that in the I think last year, WHO provide like the assessment for the migrant, health cluster, for the migrant health operation in Thailand to review what in the prioritization that we need to fill the gaps, and some of the prioritization and met within the vision and the responsibility of the Department of Disease Control. This is the first one that we need to strengthen and increase the capacity and capability of the migrant health volunteer. Because then we can see that how the successful story that we received that from in the village health volunteer in the it's just not only the COVID-19 but for the other diseases. And we know that village health volunteer, this is a important piece of jigsaw to connect the community, the villagers, and what in the measure that deliver from the government. So that's why we would like to establish this thing to the migrant health volunteer too. So that's why our department is still like a focus on the strengthening the capacity for the migrant health volunteer. And for the second project that we would like to do, that we have like the forum that talk within the IOM is another UN that in the talk among with also within the Cambodia. I think maybe in the 3 months ago that we agree that on in the migrant health volunteer can establish in the both sides of the country. So that means even that we can create in their full with equipped within their knowledge, and they can know migrant health volunteer, and they can know between the two countries, between the both sides. That means it can be like a really important project, because then we can share information. We can know who already like a trained for to understand how to communicate the community. So that means if the country in the sub-regions can have like the same thing that okay develop in the capacity of migrant health volunteer, it can be like a very impact for in the to manage or in the any situation. And also the important that RCA rapid community assessment, because in the, we know that we can focus that okay this community have the problem, and sometimes even though we just wait for like a research, right? Research is quite take time and really like a deep in detail, but sometimes we need like the short findings, and also what in the urgent finding to fill the gaps. Maybe the rapid community assessment in the specific community, in the some migrant workers or in the some shelter or the some community, it can be important to find the result and implement the measure. So this is a two project that I would like to continue and would like to propose that to our level to support this kind of project. Thank you.
Thank you, Dr. Hinjoy. And now, can I ask Dr. Kiri to also share his thoughts about this question?
Points. First, at the global and regional levels, I think there has been some documentation with regard to the inequity in terms of the vaccine distribution across the globe. In particular, for the low income country, if we look at the coverage of the vaccination during the COVID pandemic, of course, the many low income countries, the coverage is very, very low. It's compared with the developed or the middle income country. So I think in order to this is the lesson learned that we need to take into considerations. Of course, I think this also rely on the capacity of the supply of the vaccine from the beginning or from the outset of the pandemic. So I think in the future, based on the lesson learned, I think the global panel community or the regional community may to look at the first under the IHO international health regulation. I think it's already clearly set the key intervention or the key or the capacity requirement to implement the IHO capacity. One was speaking about the vaccination. So I think like in our region, I think it's Western Pacific region where they upset the action plan for the Southeast Asia disease. So I think we can revisit what are the compliant, what are the fulfillment of the key state key party in implementation this. So this will be guide, for example, the reviews or the update the IHO 2005 or the other policy or action plan at the regional level, or even the framework for the regional cooperation, like the Asian framework for health. We have the several clusters. We have the GMS, so on and so on. So I think we need to look at the all those mechanisms and the structures. And at the country level, I also support the idea of the colleague from the Thailand that the intervention is depending on what are the specific what is the specific context, what were specific event, and then the tailor of the intervention, it should be reflect or to be suitable to the country specific context. But the lesson learned from the COVID-19 pandemic so far, I think the country, I think many countries in the world has been through their own lesson learned, and also they learn from the global and the regional lesson learned, including the what went well and what didn't went well. So I think this need to be addressed at the the global, regional, and so at the country level as well.
Thank you, Dr. Thierry. So I think we've reached the end of our open forum. I would like, let's have a very quickly. We have a group photo with Dr. Banson and our speakers. And then after this short this group photo. Okay, so I think Miss Olive will be taking the photo. So
okay, everyone, please smile. Ready? And 1, 2, 3. One more, and 1, 2, 3. All right. Thank you. Back to you, Doc Gideon.
okay, thank you again to our two speakers. And for all those who asked their questions in our discussion. I would now like to call on, once again, Dr. Banson for closing remarks.
Thanks a lot, Gideon, and of course, thank you very much, Kiri. Looking forward to see you again in Cambodia one of these days. And Dr. Joy, I might be in the PMAC, so if you're there, it would be nice also to have a chat. And particularly migrant health is a big concern. I always believe that countries love to talk about universal health coverage, but but universal as an English word does not say universal in a country. It's about really the whole world, right? So if Southeast Asia, our countries in the region in Southeast Asia could have to show how health coverage can be treated as universal across borders, and of course, starting with the migrant workers, that would really be wonderful. But nonetheless, I think that's a challenge for all of us in this room. But it's a challenge that we could all address. Dr. Kiri basically showed how Cambodia was able to control the pandemic. You know, the pandemic was happening, as other countries really had difficulty coping. The reports that we were hearing of Cambodia was always wonderful. How the spread did not spread as it was expected to spread, similar to how other countries did it. When the vaccination came, Cambodia just basically rapidly vaccinated everyone. So these are really great lessons from Cambodia, and hearing it from Dr. Kiri and how they did it, I always love to keep on hearing that story over and over again. And I think this, and of course now what we need to do is to make sure that the lessons, the experience from Cambodia is something that Cambodia will use, and they're using that to strengthen their health system. And similarly, of course, for Thailand has always been considered a leader on healthcare in the region. whenever we talk to countries, they always ask us, so how did Thailand do it? How did Thailand do it? So it's and of course, they were active. It would be, and now they're really leaders now on what Dr. Hinchoy is doing on work on migrant health. We all, the countries in Southeast Asia, people have always moved across countries in Southeast Asia, as a matter of fact. And of course, we're seeing that right now. And so grappling with this problem would be something that we will closely monitor, and we in ADB would, of course, gladly support Dr. Hinchoy. And of course, with Dr. Kiri, as he has said, we're now have new projects there, including supporting hospitals. Ricard is, of course, Dr. Kiri's favorite ADB staff. I sometimes feel bad that he likes Ricard more than me, but I'm just kidding. But okay, tell Ricard this. But as I said, we look forward. Finally, as Gideon was saying, we have been working to document this. I think this has been documented. I know others have also documented lessons on what the pandemic is. But I think, but we should not stop in documenting this, because the pandemic was really once in a lifetime, hopefully once in a lifetime event. It's something that that has affected all of us. Many people have died, including, of course, I would imagine our friends. We have friends that have died. And this is like for our generation, for those of us who are in this room, this is something this is like a global war that happened. And just like my parents, because they survived World War II, would always talk about how it was in the war, how it was in the war. I think we will always keep on talking how it was in this pandemic. Not because we like to talk about it, but because I think this is something that has really changed a lot of our lives, and not just our lives, hopefully the healthcare system of Southeast Asia and the world. So we need to keep on documenting these lessons, and that these lessons we need to have this written in popular media. I'm waiting for the movie. I haven't seen it. There should be a movie soon on the pandemic, on how, because I think movies and K-drama television series would be another way in which we could tell the story. And so that they're not just limited to journal articles or very formal news articles. I think so. So really, the challenge is this for us, and as we communicate this well among us, where I think we're all experts in this, who are still left here, then it would help us really provide inputs to countries as they improve and strengthen their healthcare system. The pandemic also basically showed that a lot of our argument, and we are among health people, that investing in health makes good business, not just good business, but good economic sense. Because we also saw the pandemic has really affected economies from Thailand, Philippines, among others. Those who did a good job or not, but we saw how we see negative economic growth. So no, so in a sense, it was in a sense an opportunity really that what a lot of us has been saying, that investing in health is good economics, was actually proven by the pandemic. So let's keep on building on that. We also saw that more money was mobilized into health sector, government budget, people spending for health, people doing better health behavior. So again, we build on that. We saw vaccine communications to be now really done so well. I always tell people in health promotion, health communications, that before the pandemic, I get bored when they do presentations, because it was really done in a very, I don't know. But with the pandemic, people actually adapted to how people were, get communicated. And I'm not proposing that we do a TikTok dance now, but we've also seen how health departments, ministries of health actually started working in mediums, and which they never did before, because they were all trained to only do boring. Sorry, okay, I stopped saying about boring. Nonetheless, so these are all lessons, and we in ADB will continue to build on that. As I said, we will continue to engage Dr. Kiri, Cambodia Ministry of Health, Dr. Hinchoy, the Ministry of Public Health of Thailand, and I will look forward to see you again. And I think I do expect that we see each other again. And I would like also to thank the team, the secure team, and for all of the work that they've done. We will be sharing this publicly. This is how we've been approaching these webinars. we don't really need people to be there in the webinars. We actually make sure that it gets disseminated online, because that's how people do things now right now. So we thank everyone. We thank Gideon. Gideon, we look forward for the book, the secure book, to come out soon. And by the way, Dr. Incho and Dr. Kiri, Gideon is actually a doctor who's also an anthropologist, who've also won national book awards. So he's not your usual doctor who talks boring like me. So I think Gideon and his team will be helping us tell a great story. And we look forward that he will not just tell the story in the secure book, but he will keep on telling stories on how health systems in the region. So Gideon, eventually I will be asking you to hopefully fly to Thailand, to go to Cambodia to Dr. Kiri, so you could have them also tell the stories of what we're doing. So again, thank you again, and hope to have a wonderful. Sorry, I do follow the calendar. The calendar where December is Christmas and it's holidays. Today is actually a holiday in the Philippines. The Philippines is a Catholic country, so this is Immaculate Conception Day. So although ADB is a working day, so it's a holiday in the Philippines. And of course, in December, we all rest in the Philippines. So looking forward for an exciting 2024. And once 2024 starts, there'll be a lot more exciting things that we'll be doing all together. Okay, so again, thank you, and bye-bye. Bye.
Thank you. And on that very optimistic note from Dr. Banzon, I am ending this webinar, but not the conversation that will have to continue next year with all of us in this room and beyond. Thank you so much, and see you again in our next webinar.
Okay, bye-bye.
Bye.